My name is Judy Peterson. I've been living in Fargo for about 45 years. My passion is quilting. I taught quilting in a local store in the area. I was limping more, and I'd meet people on the street and say, "You're limping." I says, "Well, I'm old enough," and I kind of was working hard. I'm an active person, so I didn't really think a whole lot about it. But when I had my physical, she says, "Have you ever had an x-ray?" And I said, "No." So a couple days later, I did go and have that x-ray and came back with osteoarthritis, bone on bone.
This starts out as pain usually in the front part of the hip and into the groin. We get an x-ray and we'll be able to identify arthritis on the x-ray. If they haven't tried any non-surgical treatments, we'll usually start with that.
He said I could try a cortisone shot, which I did do. Unfortunately, it didn't give me very much relief for more than a couple days.
But if it's affecting their quality of life and daily activities, then oftentimes hip replacement is a great treatment option for significant and lasting improvements in their pain and function.
Well, Dr. Lindemeyer definitely made me feel like a person instead of a number. He listened to my questions. He was very willing to answer all of them and make me feel like I was an important patient of his and that he was willing to help me. So I went into surgery about 1 o'clock, and at 3:30 I woke up with an ice bag on my hip and met Seth, my nurse, and went to the bathroom, walked down the hall. About 6 o'clock, the physical therapy lady came, and I walked back and forth for her and did a few things. She says, "Yeah, you can go home."
Total hip replacements have come a long way over the years. We have developed new techniques that allow for early mobilization, pain control, that essentially allows patients to get up and move and walk much quicker than they did before. And this in turn means that many patients don't even need to spend the night in the hospital. They can go home, they can sleep in their own bed, they can take medications when they want to, they're in a familiar environment, and ultimately I think this has led to a higher satisfaction rate in hip replacements.
Being able to go home was important to me. I knew I wouldn't rest as well in a hospital because of the commotion. I'm a light sleeper. Being with my husband, who is blind, and in case he needed anything, because he often says, "I need your eyes." So it was just much more comfortable for me to be at my home.
Judith is a prime example of that. She was very motivated, she had a good support system at home, and she was able to go home the day of surgery, and she did great.
I had some pain, of course, afterwards, but I was able to manage it with Tylenol and ice, and it was it. I mean, within a few days, I was not having the limping at all. I was active about getting up and walking. Every hour or so I would get up and make a tour around the house. Well, I got a call from Dr. Lindemeyer the next morning, which just surprised me to see how I made it through the night and how I was doing. So that really reached out to me as a caring part of the Essentia family. 5 days out, I went to my first physical therapy session. And after 2 weeks, I saw Dr. Lindemeyer, and I walked into his office, and he says, "How you doing?" I said, "Great. I quilt, I read, I puzzle, I make quilts for Quilts of Valor and the church and other charities, so I'm highly motivated and pain-free." Absolutely, I love it.